Okay, so today's video is on the pterygopalatine ganglion, which is also known as the sphenopalatine ganglion or ganglion of hay fever or Meckel's ganglion. So it is known as pterygopalatine ganglion because it is situated in the pterygopalatine fossa. Okay, and this fossa is also known as the sphenopalatine fossa. That's why this name. And Meckel's is after the scientist. Okay, and the ganglion of hay fever, we will discuss it in the end of the video. So it is the largest of the four peripheral parasympathetic ganglions. It acts as the relay station for secretomotor or say parasympathetic fibers, which goes to lacrimal gland, mucous glands of the nose, paranasal sinuses, palate, and pharynx. So you know that this does a lot of work, while you will see in dissection also that this is a hidden ganglion, like in the fossa is also hidden, while you can appreciate other ganglions in the dissection, this one is a hidden one. Okay, like any other ganglion, it has a topographical nerve and a functional nerve. So here I want you to understand that I will make a diagram here. So you see this. Okay, imagine this is a nerve and this is a ganglion. Okay, and so see this nerve which goes like this and comes out just like that, it is known as the topographical because it is just there, right? It is morphologically present there, but it is not relaying in the ganglion. Like there is no use of the ganglion for this nerve here. Okay, the functional nerve is one that comes and relays here. Okay, the nerves end here, end is here. Okay, so like in this one is the maxillary nerve, is the topographical nerve. So this one is the maxillary nerve. So this one is the continuation of the maxillary nerve only. While the greater petrosal here comes in this ganglion, relays here, it ends right there. Then we have the post-ganglionic, like after the relay, the fibers join the topographical nerve only. So when there is ganglion, we have the topographical nerve coming, the functional nerve coming, but the one leaving is only the topographical one. The functional one fibers will join here only. After relay will join the topographical nerve only, and then the topographical nerve will contain both the fibers. Okay. So this concept you need to remember. Okay, this will help you a lot. Then for this ganglion, the pterygopalatine ganglion, the topographical nerve is maxillary. And as I told in the last video, that for all four of these parasympathetic ganglions, we have the trigeminal nerve as the topographical, different branches of the trigeminal. Like for the ciliary we have different. For the pterygopalatine and submandibular, we have the maxillary nerve, right? And for the submandibular, we have the mandibular nerve. And for that, we have the ophthalmic and its branch, the nasociliary nerve, right? If you remember from the last video. So here we have the functional nerve is the topographical nerve is the fifth, that is trigeminal, and we need to further remember the maxillary division. Then comes the functional nerve is the greater petrosal nerve, which is the branch of the seventh nerve, which is the facial nerve. It is facial nerve. Okay. And for this video, I will be highlighting the maxillary nerve in this green color. You will see it many times. So you see this and your mind should click. It is the topographical nerve, and it will carry both the parasympathetic and sympathetic postganglionic, uh, parasympathetic, and the sensory fiber, because it is going to be a sensory branch or a root also. Okay, so for the ganglion, what we have here, so if you know the pterygopalatine fossa, you know that on the medial wall there is a sphenopalatine foramen, and on the posterior is the pterygoid canal, through which the nerve of pterygoid canal or Vidian's nerve passes. Okay, so you will remember this, right? The maxillary nerve is above, behind is the pterygoid canal, and medial is the sphenopalatine foramen, and anterior is the middle nasal concha, whatever you say it. I say it as concave. Okay, then we have the connections. We will discuss this diagram at the end or along with this video. Okay, so we will discuss the secretomotor pathway or the parasympathetic pathway for the lacrimal gland. As we discussed, it is for lacrimal gland and for the mucous glands of all these structures, right? But we will discuss here the lacrimal gland. So firstly we have the lacrimetric nucleus in the pons region of the brain. Then we have nervus intermedius, like from the nucleus till the nerve, the fibers we have in between are the nervus intermedius. And if you're writing an exam, you need to write it. Okay, it is important. And then we have the facial nerve. As you know that we are discussing about the function, right? This is going for a function. So the functional nerve was greater petrosal, which was the branch of facial nerve. Okay, so after nervus intermedius we have the facial nerve, and we know the geniculate ganglion is of the facial nerve. So then to geniculate ganglion, and then the greater petrosal. So now you see there's the greater petrosal coming, and from the plexus here, as we discussed in a last video in this sympathetic trunk, we discussed from the internal carotid artery plexus we have the deep petrosal nerve, which comes and it joins the greater petrosal nerve. Okay, and they form the nerve to nerve of pterygoid canal, or we can say Vidian's nerve. Okay, Vidian's nerve. And then this Vidian's nerve, it goes into the pterygopalatine ganglion. Okay, now you see only the fibers of the greater petrosal nerve, the functional nerve, will relay there. Okay, the deep petrosal, they are sympathetic, right? They are doing the sympathetic supply, so they will not relay. They already relayed in the superior cervical ganglion, as we discussed already. So after the ganglion, as I said, the postganglionic fibers will go along the topographical nerve, which was the maxillary nerve. Okay, then after it will travel through the maxillary nerve only. So we have the branch of the maxillary nerve as the zygomatic nerve. Then we know that the zygomatic nerve divides in zygomaticotemporal and zygomaticofacial. Here the concern is of the zygomaticotemporal nerve. Then it gives a communicating branch to lacrimal nerve, through which the fibers goes to the lacrimal nerve and ultimately supplies the lacrimal gland. This was the parasympathetic pathway. You see here from the Vidian's nerve, here this comes, and along with the maxillary nerve the postganglionic fibers goes. So here we would have the zygomatic nerve, here we have zygomaticotemporal, then we have the communicating branch to the lacrimal nerve. Through the communicating weave the fibers go to the lacrimal, and we have the lacrimal gland. Okay, then we have the sympathetic route. As I told you here, through the superior cervical ganglion, the fibers forms a plexus around the internal carotid artery. As I told you, the fibers already relayed here in this ganglion. So the post ganglionic fibers make a plexus around the internal carotid artery, and then they go as deep petrosal nerve and then in the nerve of pterygoid canal. As you see, this nerves, yes, it goes to the pterygoid canal, but the fibers of the deep petrosal nerve, the sympathetic fibers, they do not relay in this ganglion. And then these fibers give vasomotor nerves to mucous membrane of the nose, paranasal sinuses, the palate, and the nasopharynx. And these are the structures you need to remember. Okay, they are gonna come again and again. Then we have sensory root. As I already told you, it is from the maxillary nerve. They do not relay. See, only the parasympathetic fibers will relay in the parasympathetic ganglions. Okay, remember it. And then the sensory fibers, they emerge in the branches of the ganglion. So in branches we see that the branches of the ganglion are actually branches of the maxillary nerve. As I told you that the fibers were going with the topographical nerve, right? So the topographical nerve will take those fibers and go to different targets, right? So the branches of the ganglion are actually the branches of the topographical nerve, which is the maxillary nerve here. So they carry the parasympathetic as well as sympathetic fibers. Also they are sensory, so they carry all the three. Okay, so the branches are the orbital branches. Here we can see, here are the orbital branches. So the orbital branches, they pass through the inferior orbital fissure, and then they supply the periosteum of the orbit and the orbitalis muscle. The orbitalis muscle is an involuntary extraocular muscle. Okay, in the content of the orbit, we will study the extraocular muscles, and in extraocular muscle we have 3 involuntary, and one of these is the orbitalis, and 7 we have the voluntary muscles. Okay, moving on, the next branches are the palatine branches, which are greater and lesser or middle and posterior palatine. The greater or anterior palatine, they pass through the greater palatine canal. As we study the norma bissalis, yes, we study the norma bissalis in osteology, we see in the anterior portion, we see the greater palatine foramen and lesser palatine foramen. So there should be a canal also, right? That's why they are foramen. So they passes through the greater palatine canal, then to the greater palatine foramen, and that opens in the hard palate, right? They supply the hard palate and the labial aspect of the upper gums. So the lesser or middle and posterior palatine, there are 2 or 3 lesser palatine foramens also we see. So they supply the soft palate and the tonsils. Then we have the nasal branches. They enter the nasal cavity through sphenopalatine foramen. You see, on the medial aspect of this ganglion, we studied that we have the sphenopalatine foramen. Okay, so through this sphenopalatine foramen, the nasal branches goes to the nasal cavity, and there are 2. Okay, so the one goes laterally and goes medially. So the lateral ones are lateral, and as it is posteriorly and superior also. So lateral, posterior and superior nasal branches, they supply the posterior parts of superior and middle concave. Okay, the superior and middle concave. So, and if there is a lateral one, there should be a medial one. So they supply the posterior part of roof of nose and nasal septum. So this was for the lateral wall of the nose, and this one is the medial wall of the nose. Medial wall, or you can say the nasal septum, right? So from one of the medial branches is the nasopalatine. It is the largest of these. Okay. So and if as it is the largest, it descends. Okay. So this was the um, nasal septum. So they were coming out like this. So some was going this nasopalatine goes like up to the anterior part. Okay. And then we have the pharyngeal branches. They pass through the palatino-vaginal canal and they supply part of the nasopharynx behind the auditory tube. Behind the auditory tube, the supply to the nasopharynx. And then we have the lacrimal branch, just like I told you here. So we have the pterygopalatine ganglion. Here we have the lacrimal branches to the lacrimal gland. So now we will discuss this diagram. So you see we have the topographically related nerve, which is the maxillary nerve, and the pterygoid canal, which has the parasympathetic and sympathetic root as greater and the deep petrosal nerve. And then we have the branches. First one is the orbital branch, then we have the nasal branches, then we have the palatine branches, the anterior or greater palatine and lesser, middle, and posterior palatine. Then we also study that the pharyngeal nerves, which supply the nasopharynx just behind the opening of the auditory tube. We did the nasal, right? 1, 2, 3, 4. And fifth one is the lacrimal one. Okay. So these 5 branches you need to remember. Then there is some clinical anatomy related to this ganglion also. So first of all, we know that trigeminal neuralgia is there can be effect of ophthalmic division of the nerve, or the maxillary or the mandibular division. Here we are specifically talking about the maxillary nerve, which produces symptoms in the area of the distribution of the specific nerve, right? In neuralgia, we have the symptoms in area of the distribution of the nerve. So here we have the maxillary nerve. So if the maxillary nerve is affected, the symptoms would be in the area of distribution of the maxillary nerve. So what can we, if we want to anesthetize this nerve, we will do it foramen rotundum, where it exits the cranial cavity, right? And if we are studying the pterygopalatine ganglion, as we see it, that it supplies secretomotor fibers to many glands, like the lacrimal glands and the mucous glands of the nose, palate, nasal sinuses. Okay, so if this gets irritated or infected, it will cause congestion of the glands of the palate, nose, and also the lacrimal gland. What will it cause? They will overproduce. It will cause the running nose and lacrimation, and we all are familiar with this. That is hay fever. That's why we call it the ganglion of hay fever, which I said in the starting of this video. Then the maxillary nerve, it carries efferent limb fibers of the sneeze reflex. See, maxillary nerve is sensory. It gives sensory fibers, right? So sensory fibers also carries these efferent fibers for the sneeze reflex. That's all for this video. Thank you very much for listening to me, and if I did any mistake, forgive me, and please correct me if you want to in the comments, because I can make mistakes, and in any video if you find me doing mistakes, please comment. I will definitely reply, or if I will definitely pin a comment doing an explanation for that concept. Thank you very much again.